My name is Funmilola OlaOlorun, and I am a senior lecturer in the Department of Community Medicine in the University of Ibadan, College of Medicine in Nigeria. The WGCD project, the title is a mouthful, but for short it's Women Working with Partners, and it's on promoting female empowerment within the household. And the idea behind it, behind using couples, is because we know that in Southwest Nigeria, as in most of Nigeria, it's still very patriarchal and the men are very important in decision making. The general assumption is that women do the housework, women look after the children, men figure out how to pay for everything. The intervention had three main arms and then a control arm. The first arm received gender socialization training, so we talked about the gender norms, how boys are trained to become men, how girls are trained to become women. The second arm of the study had the gender socialization training as well as financial literacy training. So we trained the couples about savings, about loans and borrowing and opening a bank account. And then the third arm received the gender socialization, financial literacy training, as well as information on family planning. Having over 1,000 couples in a study is not something you see every day from Southwest Nigeria or even from Sub-Saharan Africa. I think what was most striking were the stories that came from the sessions on financial literacy. It seems like many couples suddenly had this aha moment, getting them to sit down to think about their income and their expenditure, getting them to think about their needs versus their wants. The gender socialization piece was really very interesting. So basically we had spent time trying to get them to think differently or critically about how gender plays out in our communities before we brought them together to discuss. So I think it's something that was not completely alien, but something they had not really given much thought to. If you have couples who are now thinking through the gender dynamics in the environment in which they have been raised, and they're challenging these gender norms, and they're able to talk about household decisions and talk about financial decisions, then it's more likely that such couples will also be able to have conversations around reproductive decisions. And so if they can make reproductive decisions, then women are more likely to be able to use family planning methods because they have the support of their husbands. So that's the way we thought about this change coming about.